My name is Denisha Davis, and the coalition I decided to focus on is the Georgia Perinatal Quality Collaborative, Georgia PQC. The social determinant of health I will focus on is healthcare access and quality care to promote health equity among African American mothers. Factors that impact health equity among African American mothers include access to quality health care, chronic conditions, racism, and implicit bias. Most pregnancy related deaths are preventable, yet Black women are 3 times more likely to die from pregnancy related causes than their white counterparts. Lack of healthcare access and quality care have prevented racial and ethnic groups from having fair and equal opportunities for physical, economic, and emotional health. There remain inequalities between rural and urban communities within Georgia, and high mortality rates remain on the rise due to lack of healthcare services, quality care, and insurance coverage. It is known that approximately 500,000 Georgia women and children suffer from malnutrition within the state of Georgia. Rates were highest among uninsured women, ranked at 47 with a rate of 19.7%, and 27.6% ranked at 50 who avoided care due to healthcare costs. It is also known that infants being born in Georgia are ranked below average nationally for health indicators and highest for infant mortality rates as of the year 2017. Being born in Georgia continues to be a risk for overall health, with maternal mortality rates in Georgia ranked the lowest nationally. Though there have been improvements over the past decade, the fact that Georgia currently ranks 10% for infant mortality, preterm birth, low birth weight, and maternal mortality remain of concern. Georgia PQC's goals and objectives are to improve health outcomes for mothers and babies within the state of Georgia. The coalition aims to engage stakeholders in evidence-based practices for improvements in the quality of care. The anticipated outcomes include the involvement of all perinatal stakeholders within the state diligently working together to improve health outcomes for mothers and babies. They do so by using design protocols and strategic goals to improve health outcomes among leadership and staff. Statewide data resources by cities and counties within Georgia have provided resources with the help from neonatologists, obstetricians, midwives, public health professionals, and other stakeholders. They have provided and will continue to provide counseling, data management tools, systems, needs assessments, funds, facilities, equipment, and supplies. They identify needs and barriers with the help from patient advocates and professional organizations. They provide resources and data to health departments with the help of physicians and nurses, birthing centers, nurses, physicians, and regional perinatal centers. They fully implement change throughout healthcare agencies and communities by educating and engaging families in the quality improvement processes. There are 2 approaches that best align with the work of Georgia PQC. These approaches include building the long-term capacity of the coalition and relevant partnerships to achieve policy goals and focusing on building coalition member skills. These approaches over time have strengthened the capacity of Georgia PQC to function successfully by increasing the program's effectiveness. These approaches consist of core and complementary approaches which have contributed to the success of program over time, even though there is still work to be accomplished. Building the long-term capacity of Georgia PQC and relevant partnerships to achieve policy goals are important for sustainability. Georgia PQC currently partners with many different healthcare agencies and professionals with expertise in maternal and neonatal care. Through a continued effort to drive change, the increase in partnerships is what is needed to minimize maternal and infant mortality associated with health disparities. The internal partners of the coalition consist of healthcare professionals from many diverse levels who will enhance and support the work of the coalition and lead sustainable outcomes through knowledge, skills, and ideas. Building coalition member skills is an important contribution to Georgia PQC. The ongoing efforts to hold webinars are used as a training tool and skill building activity between Georgia PQC and its leaders and members, as well as partner agencies, to build on processes of data collection and appropriate care for improvement in health outcomes. Overall, Georgia PQC will continue to thrive if there remains the building of relationships, partnerships, new skills, and data collected. The more participation received at all levels of the healthcare realm, the more health improved outcomes will rise. The sustainability of a coalition such as Georgia PQC is important as there are funds, energy, and time that go into grouping together hospital members and agency partnerships of diverse groups of healthcare professionals. I will check in and make sure that this is achieved on a yearly basis through our spreadsheets